One of the most powerful components of hospice care is our volunteer program, which is another way that we provide support. Oftentimes we find in our elderly population that it's an elderly spouse caring for one who is ill and on hospice care, and they're needing respite support. So our volunteers provide that to give them time to go out and do shopping or spend time with other family members. And also there's a lot of loneliness that those persons feel as their disease isolates them from their community supports. And as Dr. Brown said, that death phobia kind of scares off people around them as well. So the volunteer provides companionship and support to help that person to cope with that illness and to help family members cope as well.
Now, everybody may not think they're strong enough of a person, or they may not want to become that emotionally attached by maybe volunteering in the home, but there are support positions as well where volunteers can help make a difference.
Right, we make use of volunteers in the home, in the other settings we've talked about where hospice care is provided, but also we have volunteers that do bereavement calling for us by phone and do phone contacts. We have those that also help in the office with various tasks as well.
A particular time commitment that you're looking for?
We usually look for someone to be available approximately 2 hours a week for 1 year. We try to get a year commitment because there is extensive training that we provide so that they feel competent in what they're offering to our patients and families.
What type of a person are you looking for in terms of a hospice volunteer?
You know, it's very interesting. There's almost a selection process that takes place that people who work in hospice and even the people who volunteer usually come in with the right attitude and the right value system. People usually don't want to get into this field unless they have a genuine interest in people, maybe some personal experience with hospice with a relative, recognizing the incredible support it can be. And I just want to go back and add to something you said. I was thinking the figures with many, as people sometimes don't know, that Alzheimer's, which is an epidemic, it's really a plague of our generation. We now have 4.5 million people with this, maybe looking at 12 million, 2040, 2050, unless we get better treatments. But the caregivers, by the way, not surprising to you, are 80% women in our culture. But just this figure is mind-blowing in a way to me. 50% of caregivers who are taking care of dementia, which is a drawn-out thing, but a terminal illness, 50% of the caregivers develop a biological depression. So it emphasizes what you were saying earlier. We see the family and the caregiver as a unit and give a lot of care and attention to the caregiver to maintain their health and integrity. So I think that's an important issue too.
It is.